Hello everyone, how are you today? Do you know the solving question is one of the best way to pass the MRCS exam? We will discuss all the question of eMRCS, Fawzia sheets and recalls regarding MRCS which will be very helpful for you to pass in MRCS exam. So stay tuned with this channel by subscribe the channel for more important question analysis. So here the question. A 39 years old lady undergoes a live related renal transplant. She progressed well. 2 weeks following the transplant, she is noted to have swelling overlying the transplant site and swelling of the ipsilateral limb. Urine output is acceptable and creatinine unchanged, which is the most likely cause. So here we can see a 39 years old lady undergoes live related renal transplant. She progresses well, but 2 weeks following the surgery, 2 weeks following the transplant, she is noted to have swelling overlying the transplant site. So here important is the swelling, and this swelling it occurs at the transplant site, and the swelling also present in the ipsilateral limb. So main problem here swelling, and swelling at the site of transplant site and swelling ipsilateral limb. Here they are telling another of important clue that urine output is acceptable and creatinine unchanged. What is the most likely cause? The options here are lymphocyte, renal vein thrombosis, renal artery stenosis, acute rejection, renal artery thrombosis. So here the options urine output is acceptable. That means the renal vein, renal artery and kidney all are okay. As all are okay, so urine output acceptable or urine formation is normal, and there is no obstruction in urinary flow such as in the ureter, in the urinary bladder and urethra. All the channel, all the excretory channel is okay. So there is renal artery thrombosis. It will not be the answer. Renal vein and renal artery, they would not be the option. Renal artery thrombosis, that's not possible as their urine output okay and creatinine normal. So kidney and the excretory system are quite okay. So our options lymphocyte or acute rejection, as the time here 2 weeks. We know acute rejection occurs within the first 6 months. So 2 weeks it is within the first 6 months. So here answer will be as acute rejection or lymphocyte. So let's have some explanation regarding this, but we have to remember that swelling occurs not only in the transplant site but also in the ipsilateral limb. So here we can see the swelling of the limb, and he had the surgery of the swelling of the limb. And this is lymphocyte, one of the picture of lymphocyte. This view is important to remember. So here lymphocyte, they does not occur until 2 weeks or longer after surgery. So for lymphocyte at least 2 weeks required. Before 2 weeks lymphocyte usually not possible. The second line, they however relatively common and maybe into, and the lymphocyte is much more common and it is up to 18% of the all patient. So in case of 80% lymphocyte may occur and it is relatively common, and it usually don't occur before the 2 weeks of the surgery. Symptoms usually occur as a result of mass effect and compression of the adjacent structure. So it compresses the adjacent structure. These include vessels supplying the both grafts with deterioration of the graft function, the ureter and alteration of the urine output, and recipient lower limb vessel with development of the leg swelling, and creation of laparoscopic or open peritoneal window is a favor of treatment. So here in case of lymphocyte, most of them first appears develop of the leg swelling, but the graft function also be possible to reduce with alteration of the urine output. Here we can see the types of rejection: hyperacute, accelerated acute, acute and chronic. Hyperacute, it occurs within the minute after release of the clump, and it occurs due to preformed antibody and immediate loss of the graft. So in case of hyperacute rejection, it occurs immediately during operation table, and it is due to preformed antibody and antigen antibody reaction occur, and loss of the graft occurs very quickly. Then accelerated acute, it occurs within in the first few days following the surgery. It involves both cellular and antibody mediated, and pre-sensitization of the donor is a common cause. So accelerated acute, it occurs due to newly formed antibody or sometimes the cellular reaction. Then acute occurs within the first 6 months of transplantation, and usually it's seen several weeks after the surgery, and it is usually cell mediated, and the cell is usually lymphocyte, and a biopsy taken, then cellular infiltration and graft cell apoptosis found. In case of chronic, it usually occurs after 6 months. Typically, it is graft atrophy, atherosclerosis is seen, and fibrosis occur at as it is a long time effect, and increasingly it is common problem. So these are the types of the rejection: hyperacute, accelerated acute, acute and chronic, and this knowledge is very important to answer the question. In case of acute, it is less than 6 months, and chronic more than 6 months following the graft implantation, and hyperacute occurs in operation table, and accelerated acute, it occurs few days following the surgery. So accelerated acute, it is few days. And lymphocyte, it occurs usually after 2 hours or after that. It is relatively common, and about 18% of the patient suffers from lymphocyte, and it may compress the surrounding structure. The most common symptom: development of the leg swelling and development of the swelling around the graft site. And in case of kidney, urine output may be hampered, and ureter and other structural function may be impaired. So our final answer is lymphocyte, because they came 2 weeks. Usually 2 weeks later, lymphocyte develop, and swelling in the transplant site at the same time in the limb. And urine output is acceptable. Urine output may be hampered sometime by the lymphocyte, and creatinine unsense, it also be affected, but early case it usually normal. So our final diagnosis is lymphocyte.